Inhealth is the largest specialist provider of diagnostic healthcare solutions in the UK, and we have worked in partnership with the NHS for over 30 years. We have a team of 3,500 members of staff and 2,500 clinical specialists and patient management teams. We see more than 4 million patients each year, and 98% are likely or more than likely to recommend us to friends and family.
So we're really proud to be launching the first for the UK. We've got a relocatable radioligand therapy service. So this is a unit that can, as the name sounds, relocatable. It could be moved every single day and go to very different, hard to reach locations. So it solves patients' accessibility problems, which could be a real barrier for patients attending and getting the treatment that they need along their cancer pathway.
Inhealth provide the complete solution. So we provide the facility to be able to deliver this treatment, and we also provide the staff to be able to deliver the treatments to each of those individual patients. So the new service is about delivering treatment for patients, as an example. That could be neuroendocrine tumours, that could be for prostate cancer. But there's also a pipeline of treatments coming through over the coming years, which will mean that other treatments like lymphoma and breast cancer can be treated using RLT.
As an NHS GP, I often talk to patients about the barriers, the challenges that they face when attending appointments. And when we're thinking about cancer patients, the complexity of their appointments is significant. And patients will often share, the stress, the anxiety that comes with the planning of attending appointments, the costs. Sometimes they just can't do it because actually it's really far for them and they have other responsibilities and they're not able to make it. So we're so proud at Inhealth to be able to offer this service, to be able to solve this problem for patients. And it's the thing that they need the most, to be able to solve the accessibility problems, because of course when we think about the journey that cancer patients are on, we need to make everything as easy as possible for them.
We designed the unit from the ground up, fundamentally in core around the patient and what's required to be able to deliver that. So this facility has bays for patients to be able to be supported and feel at home for their period of their treatment. Not only does it have dedicated bays that have TVs and the ability to make a drink for yourself if you need to, but also you can have connectivity to the internet and obviously use the TV to watch various different programs and feel at home whilst having your treatment. But around that there is a dedicated patient toilet that's within a few steps of each of the pods that we have, and then there's a facility to be able to dispense and draw up the radioisotope to then administer that to those patients, and then there's observation room to be able to observe those patients and have the ability to be able to oversee them whilst they're having their treatment. And all of this is lead encompassed, basically meaning that patients are protected from each other, from the radiation that they're exposing themselves to, and also others around them and the environment of where this unit situates.
As a GP, actually, until I joined Inhealth, even I wasn't aware of all the different flexible approaches to be able to deliver diagnostic scans and treatments that we have available.
So if clinicians are very excited about this and they'd like to know more about this service, they can reach out to Inhealth, they can reach out to myself to understand a bit more about what that looks like.
And ultimately, we're all here to look after our patients together. So as much knowledge as we can share, we'll also learn from feedback from other practitioners about what they might think would be a good way to continue to improve the service, and we can deliver that together.
The main fundamental query is, yes, we can help, just a question of where.